listening to that. There are translation devices there if anyone needs them. And please, if you're using social media platform, Twitter, Instagram, or anything, don't forget to use our hashtag Kurdistan Health Summit. So I would like to welcome the moderator of the panel, Dr. Narina Trushi. I would like to welcome the moderator of the panel again, Dr. Narina Trushi, Chief Research Officer for the National Health System.
Hi everyone, thank you for coming. My background, as you may know, I'm a health informatician, so this topic is absolutely fantastic from the Kurdistan Health Summit, and I think it's one of many most important topics for discussion. We have a fantastic panel with a great range of expertise, so I'm sure it's going to be a very insightful conversation, and I'll try my best to do it not with British efficiency, but with German efficiency, so that we can run on time. Can I ask Dr. Ahmed Al-Saifa to come to the stage? Thank you. If you just take a seat on the first chair, please. Dr. Remy Zikani. If you can just take a seat on the second chair, please. Dr. Amir Bibani. If you can take a seat on the third chair. Mr. Hiwa Effendi. Mr. Haribi. If you take a seat at the far end, thank you. We'll just wait for Mr. Effendi and then we'll start. Ready? Give me a second. Mr. Hiwa, please take a seat. Thank you. So we are going to discuss, as I said, an important topic, which is the importance of health information management. The aim is to bring different perspectives from a variety of different skill skill sets today. If we go around one by one, if you can kindly give introductions as to who you are and just a bit about yourself. We're going to go the old-fashioned way.
I am Dr. Ahmed Ismail Shadr. I am from the Ministry of
Sorry, are the microphones activated for the speakers, please?
Hello everybody. Is the sound good? Thank you very much. My name is Ahmed Ismail Shadr. I am from the Ministry of Health in Baghdad. I am assistant for the General Director of Planning, the Ministry. Previously, I am the manager of quality control of drug in Iraq. Actually, the importance of our subject is very important, and we have some idea about that to discuss it. Thank you very much.
I am a physician and I have a master's degree in healthcare administration from Maywood University in the United States. And I'm also board certified in healthcare management by American College of Healthcare Executives. And right now I'm president and founder of Healthcare Platform Institute. Thank you.
Hello everyone. My name is Mohammed Bilani. I'm a family doctor in MBA and health system activity at the virtual country office in Iraq. Thank you.
Good afternoon, everyone. My name is Hiwa Afandi. I'm head of the Department of Information Technology.
Thank you very much for those introductions. Thank you.
Menamasakan ke Inggerisnya, tak?
Dia atir waktu.
Mentau.
Please, can you please?
Can we go into the presentations, please?
Good afternoon. Today I will introduce to you to the basics of health information system very shortly and briefly. Okay, so first of all, I will go to the very famous pathway of data collection and process into the wisdom, knowledge, and information. So when we have data, it's the very first step that we call raw data. So how are we going to process that data? How are we going to use that data to get to the level of information and knowledge? So second stage, the data, after we organize the data, it will be information. So it can be understandable. And the third level of data, it is knowledge. So it's a more advanced level of understanding the trends of the collected data. And the last step, last level is the wisdom. It's the wisdom and mindset that we use data for our decision making, for evidence-based medicine and evidence-based management in healthcare. So that mindset, that wisdom that we use objective data for our decision is the last step of processing raw data to information, to knowledge, and then finally to wisdom. So the second diagram I would like to talk about is the process of exchanging of data exchange. So how we can exchange data between two entry points, how we can categorize that exchange. The very first level is non-electronic data. So we used to, from the beginning of developing healthcare systems, it was manual data, manual entry of data. So that's obviously non-electronic method. The second level is machine transportable data. So we can transport between two entries of data through very easy ways, just like photos we use in social media or Viber, Instagram, WhatsApp. We exchange the data, but that's the very basic step of exchanging of data. So the more advanced step for exchanging of data, it goes to the third level, machine organizable. So when you, in the second step, we don't have, the machine doesn't understand what's in the picture. The machine doesn't get it and it cannot be analyzed further. But in the third level, when you have databases, especially the databases, the machine can analyze it further to get to the trends, information and knowledge. But the last step is the most critical step, and it is what's available right now in the healthcare information system. It goes to healthcare informatics, algorithms, and artificial intelligence. So just like how we collect data from electronic health records, from interactive dashboards. So those big data can be collected and analyzed. If we integrate these two diagrams into one diagram, so just like I talked first about the levels of information, of collecting data, non-electronic data is just raw data. It cannot be automatically go to the second and third level. And machine transportable data, it gets automatically, without human interference, it gets to the level of information and beyond. Machine organizable data, just like the documents, the databases, it goes automatically, very easy to the level of knowledge. And finally, machine readable or interpretable data, it's automatic from entry point to the last step. It will be analyzed, calculated, and then go to the level of the knowledge and even wisdom to show you the trends, facts, evidence by itself without interference of human being. So that's a very easy and crucial step for the artificial intelligence, algorithms, and healthcare informatics. We mainly use health information system and technology in two main categories: for evidence-based medicine, evidence-based management. For healthcare management on one side, and on the other side for evidence-based medicine, which means clinical side of the healthcare. In the clinical side, we collect data to get us the trends, evidence, facts, even to predict the disease and the outcome, prognosis and progress of the disease. And on the other side, we use data for efficiency for operations, for management actions, just like service delivery, efficiency, quality, and overall for operations. We have a range of other uses that can be divided in both, between the two sides, which we can call it computerized physician order entry, clinical decision support system, mobile health, automatization of the processes, picture archiving, communication system, and finally telemedicine. So they are for both sides, even for clinical side and also for the management side. We have a very well-known triangle in healthcare we call the iron triangle. It's divided into access, cost, and quality, and unarguably, using of healthcare information system and technology can help all the pillars of this triangle by increasing the access, decreasing the cost, and increasing the quality of healthcare services. In 2021, WHO has developed a guideline or an initiative for standardization of collecting data, especially for developing countries. Right now, in every country, the healthcare technology is a field that has a lot of focus on it, and they are investing in this field. So, when you come to the developing country, you can see that there are a lot of gaps in standardization in filing of the data. WHO recognized that gap, has developed a guideline how we can get used to the standardization at the beginning of the developing of our laws and regulations. So we call smart guidelines that should be standard-based, machine readable and interpretable, so that's the final level of exchange of data, adaptive to our needs, requirement-based, and testable. Coming back to the saying that says what cannot be measured cannot be solved. So I totally believe in that saying. Just like in medicine, without diagnosis, we cannot get to effective management and treatment without using data to detect the gaps objectively. I think we cannot solve our problems objectively and effectively. And using health information system is the very efficient and by far the best way to measure our gaps and even our improvements. Thank you.
Thank you very much for that insightful and informative presentation. I think one of the principles of good healthcare data is how good is your data. So maybe one of the positives.
Yeah, I have read the objectives of this panel and really to go into discussing this, debating this, and where we can start and what good question is bringing on. I just want to start with one word. This is one sentence. We can only improve our understanding for disease progression in our community or in our country, in Kurdistan region or in Iraq, and also the sectors that are affected by this disease. And how can we intervene? How can we prepare our plans and intervention and cost effective? Is by, in a sustainable way, is to have a good health information system in the country that records all the vital statistics and civil registration data you have to plan properly. So, this comes to the first important point of importance of death certificate and how to register the cause of death. I link it to the recent COVID-19 shown us importance is to really invest in data. So that's the start. Data, Dr. Rabin highlighted very clearly. It's used for clinical, as evidence-based. It is for decision making in clinical and in management. We as a WHO, we focus on both aspects, but really in low-income countries and in middle-income countries, evidence-based for decision making is priority. Over to you. Anything else?
Absolutely not. I mean, it's a good start. Would you like to add to that?
Yes, actually it is very important, the quality of information that we have to collect from the workers. The workers should be well trained, and the software that accept the data should be specified and have a certain input that give the information, the exact information that we want to be feeding to the health information system. This will collect the data will be analyzed, and this analysis will be give an idea for researchers and a good evidence base for the decision maker to make the right decision in providing healthcare. Actually, I heard about good manufacturing practice for pharmaceuticals. I heard about good laboratory practice for laboratory analysis, but I didn't hear about good for health information management practice. Actually, I need to put in our record today that we need the guideline for that practice, and I think the WHO can support us and can prepare that guideline, because it is a very important guideline and can be worked by all developing countries, and this will be very beneficial to unilateral management information, health information system in all countries, and can provide a good service, health service to these countries.
So based on that, I want to touch more on the standardization and then on the encryption of the data and how you decode that from a government level. Dr. Zakani, if you can just talk a bit more about
کۆکردنەوەی داتایەکان لە ڕێگەی واتسەپ و ڤایبەر و ڕێگەیانە بێ ڕسمی دەیتا گیراوە بۆ شوێنێک ئەوها زانیاری کۆکراوەتەوە کە ئەمە باری حکومەت قورسەکە بۆ بە بیدایەت بە میکانیزمێکی بە پلاتفۆرمێکی ئینتەراکتیڤ لە هەموو ئێندپۆینتەکان لە هەموو نەخۆشخانەکان بە یەک بەرنامە داخیلەکە لە کۆتاییدا بەخۆی ئەنەلایزکە بەخۆی ترێندەکانە پیشاندا بەبێ ئەوەی لە ناوەند کەس هەبێت بەبێ ئەوەی پێڕای بێت بۆی بێدایەتر بێت پریسایزتر بێت ئەوەی کە بەدەستخۆشیشەوە ئەوەی لە تۆمارکردنی کۆڕۆنا ئەمە شتێکی باشتر ڕێگایەکی باشتر بۆ دەستخۆشیەوە ونمونەیەکی جوان بوو بەڵام لە کۆکردنەوەی داتای کۆڕۆنا ڕەنگە دەتوانرا زۆر بە جوانتر ئیستیفادە لێ بکرێت لە تەکنۆلۆژیای زیادیاری و شتێکی تریش هەیە بیرمان نەچێت دەبێ کەلتوری بەکارهێنانی تەکنۆلۆژیای زیادیاری لە کوردستان دەوڵەمەند بکەین ئێمە پزیشکمان هەیە سپۆرە تا ئێستا ئاشنا نییە یان زانیاری زۆر سەرەتایی هەیە تەنیا ئیمێڵ دەتوانین بەکاربێنین ئەمە ئەبێ ئەو کەلتورەش هەم بدەین کە چۆ خستە ناو دامەدەستگاکان بە مەجبوری دکتۆرەکەش خۆی بادەنێت زۆر بواریتری تەکنۆلۆژیان هەیە کە لە کوردستان لێنەکراوەتەوە بە ڕابەت دوبارەیە کە بۆ تەنیا زانیاری گواستنەوە بۆ واتسەپ و ڤایبەر ئەوە شتێکی زۆر سادەیە بەوە دەوەری نەگری دنیایەکی بزانین دنیای دەرەوە خەریکی چیە لە بەکارهێنانی artificial intelligence کە تەفرێکی تری لە جیهاندا لە بواری تەندروستیش هەم لە بواری کلینیکەکەی هەم لە بواری ئیدارەدان ئێمە ڕەنگە لە بواری کلینیکەکەی گەر لە کوردستان ئەگەر بەکاریشی نێنی ڕەنگە بتوانین ئەو بواری کلینیکە وڵاتانی پێشکەوتوو بەکاربێنین هەمان دەیتای ئەوان بەکاربێنین کە زۆر نزیکە بێ لە دەیتایەرێ بەڵام لە بواری کارجێڕی کەس نایە و ناتوانین سوود لە هیچ واتێکی تر بینین ئەبێ بۆ ئێرە بۆ قەوانین و یاسای بۆ ڕێنمایی ئێرە بۆ کەلتوری ئێرە بۆ دامەدەستگای ئێرە دروست بکرێ و بدروێ بەبەر دامەدەستگای تەندروستیەکانی کوردستان بۆیە ئەکرێ زیاتر بەلایەنی کارجێڕی بدەین بەلایەنی ریپۆرتینگ و دۆکومنتیشن بدەین کە سوودێکی یەکجار زۆر بتوانین لەم بوارەوە ببین.
Thank you very much, Doctor.
One of the things that came out of that was screening tools, which we will expand on, based on good quality data, as what cannot be measured cannot be solved. But before we do that, I'd be welcome to expand on maybe the encryption
level of data is important and your perceptions.
Thank you so much. Allow me to start by expressing how shocked I am that all these highly qualified and educated people and all distinguished audience that we all are discussing symptoms and data at a low level, a system there. I'm shocked that, forget about digital systems. Why don't we have a national health strategy? What is that? Is it formulated? It is not. And then, when we talk about good data is a product of a system. A system itself is a product of what? Of a strategy that you're following, a blueprint, roadmaps, and so on. So, without wasting the valuable time of the audience talking about a system there, a data there, an interconnection there, it's about a national digital health strategy. We need to agree on that at a high level. So if you look at the global strategy on digital health, they have strategic objectives. It's for 2020 to 2025. So first, maybe the first objective is not really related to Kurdistan because we are not a developed country, but they talk about how the knowledge can be transferred to the least developed countries and how to help collaborate and share this data. The second objective is helping the least developed countries, such as Kurdistan, to have a national health strategy. And the second is to have a governing model around it, so that security, privacy, integrity, safety of the data is granted, and we have interoperability in place in terms of data governance. And you need a strategy for national health, because that will result in having a proper strategy with the important components such as investment, leadership. I mean, the strategy is actually out there. So we talk about interoperability, integration, services, and so on. So I was really expecting that, forget about digital, that there is a national health in place. It is not. So the first thing that we should do is to make sure that, and that's, when I spoke with Dr. Aras, I told him I will be criticizing you for one point. And it's the title of this panel. We need a panel to energize the government, to push the government to create the required environment for all these health professionals to participate in drafting a national health system strategy. And then we can talk about system. Yes, the private sector, for example, helped us to create a vaccine app for coronavirus, or we could utilize data to create a dashboard to say how coronavirus is spreading Kurdistan region. But these are tiny things. We have private sector, a system here, a system there, a hospital here, a hospital there, a pharmacy there. They have little systems, but there is no data sharing between them. And why? Because this is, again, part of the broader strategy of digital transformation strategy. Kurdistan needs a population information system. We need digital identity for every citizen living here in order for you to be able to connect these data sets, in order to be able to create a medical record, so that a person going to a hospital in Zafo can actually, his medical records can be reviewed by another, like doctor in Suleimani, for example. And these are the things we should be addressing, and not how we develop a system here and a system there. And I completely agree with Dr. Rabin on the characteristics of the system, like artificial intelligence, how it could be used to enhance our health sector, how what the raw data and information and the machine readable information are. But before that, we need to draft this strategy and to have an inclusive plan in order for all of us to know how to move forward and how these stakeholders actually to contribute to a health system in which patient is at the center. So we talk about person-centric, patient-centric information systems. I'm sorry, I think...
I absolutely agree that absolutely, I mean, you're right, it should be at national level, and it should be a national strategy, and we need to think outside the box. The question I would pose to you is, what's stopping us from doing that?
And are we collecting the right level of data at, say, population level? Is the system currently adequate? Is it fit for purpose? Because, you know, there are some family physician practices that may have their own private information systems to collect patient data. But what is a barrier for the region to develop a national strategy? Is it a lack of understanding of a national IT infrastructure? Is it investment? Or is it generally, it's just a new phenomenon for the region? And how can we put in a national strategy? How can members of the audience and ourselves as panelists feed into that? You know, because one can argue, perhaps, maybe Dr. Revin will argue, but we don't have perhaps a system first, how can we do a strategy? But likewise, I agree with you, how can you have a system with that? So they kind of work in parallel with one another. That's my question to you. And I'm sure members of the panel might want to comment.
Reforming the health sector is not separated from digital transformation of the country as a whole. The difficulties facing having a unified health information management system partly goes back to the lack of population information system. And that's why it is absolutely the right way to start. We cannot stop the development of these localized systems using different identifier for people until we get them. But it is definitely important that we create the urge, and it could be created by Dr. Reagan and other distinguished audience here. You can create the urge at the highest level. Maybe you should pressure the Council of Ministers to listen to you, and we will be supporting you. At that level, we have to create the urge that there is a missing strategy. That strategy will bring us to the table, and then we will see what is missing. One of them will be, for example, population information system. The second, the infrastructure for it to support it. Investment, the government. All this will be a result of that discussions and that strategy, and then we will see how much money we have, how many resources are at our disposal, and how we should move forward, because we should move based on priorities. We cannot do everything at once, but we can prioritize and we can implement. What makes me really happy is that as human resources, we have very, very capable people, but we are failing at a higher level, at governance level, and how to put these things together.
So one of the things that cannot be measured, cannot be solved, I think, you know, we would agree, is probably strategy, system. Karibi, how would you take Akiwa's comments as the head of department in the Ministry of Health? If you just give us some insight into the data you collect, the systems you have in place, and do you agree or disagree? It would be just useful for us to understand your position.
أروى دكتور ربيع ماسي أويكر ماسي كورونا كذا لكن كتشون بتشتا لما يست السيستم يكمل هنا وزارة التدريسي كتايبة بتيستي كورونا أو حالات يعني كتيست دكان الشيء كي أونلاين وين دكارتوا لهم بنكو سندركاني كتيستي كورونا تلقى وشان فورمي كشغاني كسفر دكان فورمي كباركود دي بيويا أروها أو حالات يعني كبونا خوشي بكارتين أنا أني بو إجازة أو سيستم من هي بركاري استديش دكار نفروض خانون دمار زكانش مكانه. اگر بیا سر سیستمی کردوار یان او سیستمی که استفاده کرده بود بتینی واکسین پیدانی واکسین که او شتیکی میه بالنسبه هریم کردستان یکم جار واکسین برید بشوی کی سیستماتیک و خوش وقتانه سبتونیا و بشوی کی باز بره و داشته. تا است زیادتر نمودن حوالاتی خوی تومار کردیا خود دستر کردیا. هر وها حوالاتیانه کسردانش دکن. كداني خوان تومار كم لسيت شركة خوان تومار دكان دواي أول نامه كان بود دقرته وكا شنو كاتي جاري كراوا بوي سرداني بكاتن فاكسين وقديتن بدس خوشي بو كومباني كدرست كرديا زايد أول استا كارتي فاكسين بردستا هروها بلا ما مشكلة بعدس لسر خلل كان يعني إما سيستم مان هي وسيستم زور باش مان هي هذا هاتوش بتماني سيستم باش تدرست كان فلا مشكلة لبكار هنا خلق كي إما سيستم بكار هنا دبيت الإما أو يبغوري كاكي الجزار بشتكي يعني خلق كتير جيني سيستم شتكي باش ده كان بشوي كيزور آسان بردس ما تبي ولا لو سيستمي كوربان سيستم دزاني بدأ دزاني شان خلق كل كمال كتير شان خلق تبدأ شان خلق زرعية كتير شان خلق زرعية كتير شان بارسي من هيا لهذا الكيف لهذا الثاني مسألة بارس جاي كم هو شتكي باش وجن سيستمي أو فرمان براني كلا وزارة تندرستينا أو أبد تايبة بقولنا أجر إجازة بكات يعني هذا معلوماتك غير خاصة بقدر وضعنا إصباري خوي يستاجر باسي quality control بكين quality control سيستم ولا دوزار الدواء سيستم كبركارو ولا دهاتش بتماين همو بنكو مراكز كان هروا همو درمان خانه وفوقا كان خاصة فوق بس إنه با quality control يعني أجر هواي سرداني درمان خانه كاتن باركود اللي داتن تزاني أو درمان بقاطع خارجنا مشيواز رسمي داتن لبرنامجنا لو هرچی قانونی که بگیرد سیستم هاوشوی درمان که به هیچ شوی هیچ قانونی داخل نمی‌کنه اگر وہ سیستم دا تپام نمی‌کنه. اوش لبرنامه لدهاتی کی موزی ان شاء الله دعای بجتنی روزنامه کی شرکت انجمن وزیران دستواری جیبه کردن. هر بار لبرنامه ما سیستم درست کردن تایبت بنخوش یعنی است نخوش هیا كمان نخوش إذا سيدر سردان سيد دكتور جواز بقاته هاد دكتور وكيل في كل علاج بقاته ببيه هدية خوي فيما بتمان السيستم درست كين هاد نخوش سردان هاد دكتور يجيكر كأيديكي قدرس دكتورن بيد دكتورن أيديكا نخوش كناو نشان تقدر ما نقول لك بتش حساسية فهم تومار دكتور سردان أجر بدون أجر لهولير سردان بقاته وبروات الدوم يا بروات السليماني همان أيديه أو لا تبر بارك سرداني دكتوري تشيلني شيء بكرة شيء وربيتيا وأنا أقول لبرنامج الله مشكلة هذه دورة لبكاتينا يعني.
Thank you so much. I'm being alerted that we need to go into question time shortly. I just want to pick an important point before we go to question time that we just focused on, which is how we can benefit the data we've currently got in the system, of course in line with the national strategy, which kind of goes into artificial intelligence, which is the interesting element once we have a strategy in place. And things like a disease register. So, with data, when you've got a data system, you can build a system in a system and, have like disease prevention registers where you can screen, you put the parameters in for somebody, preventive healthcare basically, if somebody's pre-diabetic, you recognize them, you treat them before they become a burden on the healthcare system. And I think that's what the panel has kind of briefly touched on. Let's go to Q&A and see what you feel and put your questions towards our distinguished panelists. Does anybody have any questions? Doctor? Yes. Oh, sorry, I was meant to call out name, but you can ask your question, sorry. Yeah, just if you can answer this question, then I'll give this. Sorry.
Thank you for those interesting topics we touched. Regarding the strategic policy for health,
first and before everything, it needs a serious political will. Without it, nothing can be done. I think Akiva pointed out this very clearly. So, how you are going to create this? It is out of the hand of this meeting. And this meeting can present the best
and send the message out to the Council of Ministers how urgent this matter is. That's number one. Number two, I think Mr. Harvey said they have a system that they can trace any drug or any food, whether legally entered or imported or illegally. Could you tell me, or could you just put some light on the traceability system you have, please? أوي كوتت أجر هالخوراك يجي هالدرمانك هتبيت ناو يا مأزانين يعني أو صراخ كردنا أو دوزينوية شون أكل.
استا quality control استا أو بردستا لquality control هر درمانك بيتن طبيعي بس سيستم دا دروات درمان أو تنا أقدارن بلام قاچاخ أجر هبيتن أو موضوع كذا ستيكر ما هي أو ستيكر فيه نبيتن أو قاچاخ حساب دقيقة كبر سيستم نهاتيا هروها خوراك وخواردن وخواردنوا كشتلا برنامج موافقة ورنجيرا وبلين أو بلام لدهاتو بلي وكو درماني اللي ديتن يما شون صراخ يبكين صراخ لريلج نكان أو صراخ دقيقة وباج نمبري هم مشتى كداخل ده باج نمبري هي كداخل ده بيتن بود زانين
بەڕێزت لەسەرەوەی کە پۆلیتیکەڵ وڵی پێویستە و ناتوانین بەبێ ئەوان هیچ بکەین بەڵام لێرە بەشێکی گرنگی هەیە کە ئێمە چۆن بیرۆکەکانی خۆمان لۆبی لۆ دەکەین و دەیفرۆشین چۆن دەتوانین مارکێتینگ لۆ بیرۆکەکانی خۆمان بکەین چۆن دەتوانین وایان لێ بکەین قەنەعەتیان پێبین ئەمە دەکەوێتە سەر بڕیار بەدەستان و پسپۆڕانی بواری سیستەمی تەندروستی و بواری ئەوەی ناو لایەنی حکوومەت و دەرەوەی حکوومەتیش بە هەمووان پێکەوە چۆن بتوانین قەنەعەتیان پێ بکەین بەڵام ئەمە ئەبێ سەرەتا بە خۆمان قەنەعەتمان هەبێ کە بڕیاردان لە دنیای ئێستادا بڕیاردان بڕیاری مەزاجی نییە تۆ کەسێک بڕیاری کەسی بێ من ئەوم پێ باشترە لەم بڕیارە بۆ ئەوە باشترە بۆیە ئەبێ خۆمان سەرەتا باوەڕمان بۆ بێ ئەڤیدەنس بیست دواتر بین دوایش کە خەڵک قەنەعەتی پێنیە لێرە ئیدارەدانی باش دەوێت چۆن وا لە پسپۆڕەکان دەکەی وا لە کارمەندەکان دەکەی وا لە خەڵکەکەی کۆنسیومەر ئیمپاوەرمنت چۆن وایان لێکی بەکاربێنن لێرە ئیدارەیەکی باشی پێویستە دەبێت قەنەعەت بە خەڵکەکەش بکەی بە پۆلیتیکەڵ وڵیش بکەی کەواتە ئەرکە گەورەکە لەسەر هەمومانەوە پسپۆڕانی تەندروستی.
I will quickly, because it's very important what he mentioned. The guiding principle of the WHO strategy is when they start with it, they say it requires a decision and commitment by the member states to do so. Absolutely on point. And I suggest Dr. Aras and the organizers of this event, if I have your attention, it will be excellent if this summit comes up with a set of recommendations for the government, and you can make a national digital health strategy a priority that you could, I will make sure that it reaches the highest level, and then we can start from there. Because a country like Kurdistan can never work from bottom up. We are not an advanced country. Things should be top down, from leadership. We have to incept the idea. We have to make them aware of the idea, and that's how it works.
Thank you so much. I'm getting signals to stop. Yeah, stop. Okay, I think we've gone over our time. Can I give them 10 seconds to wrap up? Or no, we've fully stopping. Thank you so much. I've been told this session is over. Thank you so much for joining us today. Maybe we can expand on this in a few weeks. Okay, thank you.
دەستان خۆش بێ زۆر سپاس من دکتۆر تایر هەورامیم لە حەقیقەتە ئەوەی ئەو باسان کرد هەبووی ڕاستە بەڵام من یەک پرسیارەکەم ئێستا گەر بڕۆی 100 کەیس شیربێری لە کوردستانە 100 کەیس شیر لە هەر خەستخانەیەک لە 180یان پڕ نەکراونەتەوە بە دەستیش پڕ نەکراونەتەوە ICD تێنیش بە هیچ شێوەیەک وجودی نییە لە کوردستانە for data collection یعنی ئێمە کە نەتوانین دۆکیومنتیشنی هەموو ئیشەکانی ڕۆژانە بکەین بەدەستیش نەتوانین بینوسین کارمەندەکانمان هیچیان لە ئینتەرنێت و لە ئینترانێت نەزانن لە داتا ئینتری نەزانن ئەم حەزەرەی ئێوە یعنی هەر ئێستا لەگزەری زۆر سپاس.
They're telling us that we Thank you. Okay. Thank you.
Thank you very much.
Yeah. Yeah.
بەڵێ ببوورە من دکتۆر سەباحم بەڕێوەبەری گشتی تەندروستی سلێمانی ببوورە کاتەکەش تاخیرە بەڵام پێم خۆشە یەکەم ئێمە باسی ئەو عەرقەلانەیە ئەو چەلەنجانە بکەین کە ئێمە وەکو لایەنی تەنفیزی هەمانە لە جێبەجێکردنی ئەم هێڵس ئینفۆرمێشن سیستەمە یان هۆسپیتال ئینفۆرمێشن سیستەمە ئەوەیە کە یەکەم ئەو هیومەن ڕیسۆرسەی کە کاک دکتۆر تایر باسی کرد ئێمە عەرقەلەی زۆر گەورەمانەیە ئەگەر تۆ بزانی ئێمە مۆزەفەکانمان ئەوە چەند ساڵێکە خەڵکمان بۆ دانەمەزراوە ئەو کەسانەی کە هەمانە لە ساڵەکانی هەشتایە تەخەڕۆجیان کردووە ناتوانن زۆر بە باشی ئەم سیستەمە بەکاربێن ئەمە یەکێکە لە عرقەلە گەورەکانمان ئەگەر بمانەوێت سیستەمی ئەلکترۆنی بەکاربێن لە نەخۆشخانەکان پێویستمان بە سەرچاوەیەکی مرۆیی زۆر هەیە و دەبێت حکوومەتی هەرێم بیر لەوە بکاتەوە کە بۆمان دامەزرێنێ یەکێک لە کێشەکانی کەمان ئەو لۆدەیە کە لەسەرمانە ئێمە یعنی پزیشکێکی هەناوی ڕۆژانە کە لە کلینیکێکدا نیشێ بەیانیان زیاتر لە 70 نەخۆش 60 نەخۆشە بینێ چۆن نتوانێت داتایەنتری بۆم 70 نەخۆشە بکە لەبەرەوە یعنی سیستەمەکە شتێکی کۆمپلێکسە پێویستەکە هەموو شتەکان پێکەوە بگۆڕێەوە لەسەر مەسلەی استراتیژیش یعنی ئەو سامپڵانەی کە کاک حربی باسیەکە یعنی بۆ ئەوەی کە خەڵک گومان نەکا لە تەندروستی پێویستەکە دەست بۆ ئەو شتانە بەرن کە گومانی لێ ناکرێت مەسەلەن جەنابەت باسی دەرمانەکەی باسی خواردنەکەی یعنی من هەستەکەم ئەمە من نا خەڵک هەستەکە کە ئەمە لەوە چێت غەڕەزێک لە پشتیەوە بێت تۆ بۆی ئەماکەی بەداتا بۆ نایە کرۆنیک دیزیز بکەی بەداتا بۆی بزانی چیت پێویستە مانگانە دەرمان بکڕی بۆ نایە ئەو شتانەی تر کە ضرورە لە سیستەمی تەندروستی ئەوانە بکەی بەداتا کارتی ڤاکسین بەسەر سەر و بەسەر چاو بەڵام کۆمپانیاکە پارەمان لێ وەرەگرێت نەخۆشەکانی وەرەگرێت دەیان پرۆژە هەیە بۆیە پێویستەکە یعنی استراتیژی بە تەکنۆلۆژیکردن لەو شتانەوە دەست پێ بکا کە زۆر گرنگە بۆ ئێمە وەکو سیستەمەکە و بۆ نەخۆش نەک بۆ جهەتی تر زۆر سپاس.
Thank you so much. I'm told that we've got 2 more sessions in 30 minutes. That's the reason they want us to stop. Maybe we can discuss and answer the question in the coffee section. Is that okay? I'm getting red eye signals that we need to stop. Thank you so much. Cheers.
Ladies and gentlemen, please remain seated. We still have 2 more sessions before we break off. Thank you. Thank you again to our panelists and our wonderful moderator. We will start our next session very shortly, where we are honored to have Dr. Wissam with us from UNDP, the United Nations Development Programme of the Iraq Office. And we will be discussing very shortly the health SDGs or Sustainable Development Goals in Kurdistan. Very shortly we'll begin. I thank you for your attention and for your continued presence here. While we await our speaker, I'd like to remind everybody that if you have any questions, please feel free to raise your hand to our wonderful volunteers, Mustafa and Christina. They'll be taking your questions for us for the end of the session. While we await the setting up of the stage, I'd like to remind everybody that we will have our next 2 seminars in the next space of time. The first one is by Dr. Wissam, who will be speaking on the Health Sustainable Development Goals in Kurdistan region. As ever, if you have any questions to address our speaker, please feel free to let our volunteers know and they will take your names down. Thank you.